signs and symptoms of multiple sclerosis in women. Multiple sclerosis, often referred to as just MS, is an autoimmune neurological condition that can impact patients in various ways, and can even be fatal due to complications in some rare cases. While the condition is progressive, it can have varying symptoms in women compared to men, and women are more commonly diagnosed with the condition, about 4 to 1, according to ScienceDaily.com. Let's take a look at 12 signs and symptoms of MS that are common among female patients. 1. Mood impacts women's health. Talks about cognitive and emotional problems related to MS in women as one of the early markers of the disease. About 60% of those with a MS diagnosis also suffer from some form of emotional distress, it adds. Mood-related symptoms include depression, irritability, mood swings, and fits of crying or even laughing, it notes. Cognitive signs include memory trouble, inability to multitask, and trouble with concentrating on a task, it explains too. Loss of coordination. MS involves the body's immune system attacking the nervous system that controls movement and other functions, so it's no big surprise that it can impact coordination. Healthline.com says MS patients can experience balance problems along with the lack of coordination, and the patient may feel more clumsy than usual. It notes there can also be difficulty in moving limbs, as well as trouble walking. 3. Periods. And this symptom is quite specific to women, and it involves the menstrual cycle. Women's Health explains that any illness that throws your immune system out of whack, like MS, can block your period, a condition called amenorrhea. It's quite normal for your body to skip a period occasionally due to stress or temporary illness, but if your period disappears for more than 3 months consecutively, with no other explanation, then you will want to consult a physician. 4. Feeling unusual sensations. Women's Health notes that there can be some sensory issues connected with MS, and they can be somewhat complicated. For example, when they put on their shirt, it feels differently sliding over their chest than it does going over their stomach, it offers. It cites a celebrity example of actress Jaimel Ensigathor feeling an odd sensation in her legs at age 20, only to be diagnosed with MS a short time after. Legs are often the first place you'll feel symptoms, but the back is another common problem area, it adds. 5. Extreme feeling of fatigue. MSTrust.org calls this MS fatigue, and says it's very different from simply being tired or even exhausted from activity. This form of fatigue often involves the sudden loss of energy, and not being able to continue an activity, it explains. This fatigue can either be physical, mental, or both, it adds. Feeling very tired can affect short-term memory, and the ability to find the right words, it adds. Rest can sometimes reduce your MS symptoms, but the fatigue cannot be dealt with in the same way as those without the condition, it adds. 6. Loss of color acuity. Women's Health says that even if you once had a good eye for distinguishing colors, MS creeping in can take away this ability. This related condition is called optic neuritis, and is a result of loss of insulation around the optic nerves in the brain, it explains. On top of losing color acuity, MS can also cause partial blindness or complete blindness in one eye, it adds. The onset of visual problems associated with MS tends to be slow, it explains. If you notice any major vision changes, seek medical care soon. 7. Random nausea or dizziness. Nausea in women can be triggered by pregnancy, or perhaps overindulging in certain foods, which men are also prone to, but the nausea that comes with MS is often connected with dizziness, explains Women's Health. It says an early MS symptom in women is extreme vertigo, the feeling like you're on a roller coaster or perched somewhere high, and it's caused by an inner ear problem. Dizzy spells aren't a clear sign of MS, as they can also be a result of anemia, reactions to medications, low blood sugar, or low blood pressure, it adds. Let your doctor sort it out. 8. Sleepy feet. That pins and needles sensation can happen if you're sitting in the same position for too long due to lack of blood flow, but if you find your feet are falling asleep more often than usual, then it could be your body trying to tell you something. Women's Health says that frequently tingling feet, legs, arms or hands can be a sign of MS. However, These feelings could also be red flags that something other than MS is up, such as peripheral nerve damage, infections, malnutrition, or thyroid issues, it adds. 9. Bowel or bladder behavior changes. MS messes with the pathways of the nervous system that regulate bladder and bowel muscles, which can in turn cause more trips to the bathroom, notes Healthline. Possible related problems include trouble starting urination, more frequent urge to urinate, bladder infections, incontinence, leakage, constipation, or diarrhea, it adds. 10. Can't distinguish temperature. If you're holding an ice cube, you should be able to tell it's cold, right? Not always the case if you're dealing with MS, notes Women's Health. It says it can be tough to distinguish whether water in a sink is hot or cold if MS is affecting your nerves. This might also mean you're no longer able to sense changes in temperature with your hands, which is another telltale sign of MS nerve damage, it adds. If you find that it's tough to tell if the bath water is the right temperature by dipping your hand in, see a doctor. 11. Symptoms worsen after menopause. Here's another one that's exclusive to women. The National Multiple Sclerosis Society says that about half of postmenopausal women with MS in England reported worse symptoms from menopause. However, 75% of women among this relatively small sample group said their MS symptoms improved with hormone replacement therapy. The researchers suggest that the results of the small study support the possibility that the drop in estrogen levels that accompanies menopause may have an adverse effect on the MS disease process, it adds. However, hormone replacement therapy carries risks and more research is needed for this purpose, it explains. 12. Improvement during pregnancy. We thought we'd end this one on a slightly more positive note. Healthline.com explains that not only has research found that MS doesn't affect female fertility, symptoms might actually subside during a pregnancy. The source says for most women, MS symptoms actually stabilize or improve during pregnancy, especially during the second and third trimesters. So, if you have MS and want to be a mother, the disease won't stop you. However, something to consider is that symptom relapse is common following delivery, it adds.